Why don't we just pause and ask ourselves, okay, as a team, let's come together. Let's look at these calendars and let's take off things that don't meet the criteria of mission critical. I'm not here to change anything unless it's critically emergent. I just need to soak in and learn from all of you how you like to do things. I need to see with my own eyes. I was like, what do you mean? Fudging my own data? She's like, how did y'all go from 10th percentile to 90th percentile in such a short time? And I'm like, I gave nurses time back with their patients. The work we do is so very intense. It's literally life or death. It's unlike any other industry.
Ready to shatter the status quo and unleash your leadership potential? Sick of the same old tired leadership advice? Well, get ready to disrupt your thinking and transform your leadership skills. Welcome to Sound Leadership with DJ, the podcast that's about to challenge everything you thought you knew about leadership. Join DJ as he dives into the trenches with industry trailblazers, exploring the real issues leaders face today. From innovative strategies to proven techniques, we'll uncover the secrets to taking your leadership from good to great. Get ready to be inspired, challenged, and equipped to conquer new heights. Join the movement and let's redefine leadership together. This is Sound Leadership with DJ. Leadership redefined.
Welcome to Sound Leadership with DJ, the podcast dedicated to exploring the essence of leadership. Here, we're about connecting you with visionary thinkers and trailblazers who have reshaped the leadership landscape. Every episode is a new adventure where we walk side by side with leaders who have achieved remarkable success. We trace their journey from humble beginnings to leadership prominence, uncovering the challenges they face and the wisdom they've collected along the way. In this episode, it is no different. I am thrilled to feature Dr. Megan Carter, DNP, RN, nurse executive, and a transformative leader who has made a significant impact as the president and founder of MC Healthcare Consulting LLC. With an impressive 18-year career in healthcare, including 12 years in executive leadership roles, Dr. Carter brings a unique perspective as a published nurse scientist and a 2024 Nurse Executive Fellow. Her groundbreaking research on nurse managers' resilience during the pandemic and her expertise in healthcare process optimization make her a compelling voice in today's leadership conversation. Having led over 5 hospitals and multiple specialty service lines, including critical care and cardiovascular services, Dr. Carter embodies what it means to be a chaos whisperer. She's going to talk to us about that today and what that means. Today, she'll share her invaluable insights on managing time, meetings, and calendars effectively as healthcare leaders, creating space for true innovation while maintaining operational excellence. So join me as I sit down candidly with CEOs, entrepreneurs, and other community influencers as they share their stories and their pivotal moments that have defined their leadership journey. So whether you're refining your leadership skills or just starting to carve your own path, Sound Leadership with DJ promises enriching content created just for you. Now I know what you're thinking. How do I stay engaged? How do I stay involved? Well, you can simply search Sound Leadership with DJ, hit that like button, and hit that subscribe button. Follow us on LinkedIn and YouTube at Sound Leadership with DJ. Now, when you're on the go, we're everywhere where you are. We're everywhere where you are. You can search Apple Music, iHeart, Spotify, Alexa. Simply say Sound Leadership with DJ and hit that subscribe button. Now, prepare to embark on a journey of inspiration and empowerment and transformation. This is Sound Leadership with DJ. Welcome, Dr. Carter. How are you doing today?
I'm doing great, DJ. How are you? Thanks for having me.
Hey, I am okay. I know I did that introduction and I, spoke about your many years as a healthcare executive, many years as a healthcare leader, the fact that you're a nurse scientist, but I butchered it. I always tell people, I butchered it. You can tell your own story. So tell us who you really are.
Oh, I love that question. So beyond professional, I am a mother and a wife. I'm a native Texan. I'm a big bird nerd. I've discovered bird feeder cameras and I know how to identify them. I get very easily distracted by that. And I'm a new entrepreneur. I'm just in my first year of this journey. So this whole first year has just been an absolute learning, humbling, networking, and I've learned so many new things. I'm so excited to share with anyone who's looking to start their journey as well. So grateful to be here.
Wow. Now, she was a little humble. We didn't talk about the many years of experience you have, the fact that you're a nurse executive, a nurse scientist. Many people don't even know nurses scientists exist. So tell us a
Yeah,
little bit more about your healthcare background and how
sure.
you got to where you are today, Dr. Carter.
Sure, sure. So I started out as in that traditional RN path. I was a new grad on a progressive care unit. Loved that hospital. I'm actually going to have dinner tonight with two of the people who were my mentors way back when. And then I just went from there. I became a supervisor. I've been an educator. I love cardiovascular, so I moved on to that specialty as a clinician. And then I got talked into being a manager, which was a huge learning experience for me, as it is for a lot of those new nurse managers. And then had an opportunity to become a director in another state, and took over a really large service line. And as it happens with all nurse leaders, you just keep saying yes. So you kept adding. So I went from critical care and respiratory, and then they added neuro and stroke. And then we added CV, and then we added orthopedics. So that job was probably one of the best when it comes to learning how to adjust and learning how to bond with people when you have very little time. You want to have meaningful engagement with your team when there's 800 of them and one of you. So that was a huge
Wow.
learning curve for me. And I'm still very attached to those folks. We stay in contact. And then the pandemic hit, and I was in the middle of my DNP journey, which I don't
Oh, I know that
recommend.
journey.
Yeah, it just added that extra layer, right? So yeah, moved cross country in the middle of all that back to Texas for this incredible opportunity to be an associate chief nursing officer, which was always a dream of mine. And so rode out the pandemic with that team. And then in August of last year, finally was able to take a breath after all that and just said, you know what I'd love to do is just take a few months off, take a sabbatical, which I know is not traditional. It's not popular in the States, especially not in healthcare. But I was grateful to have that opportunity because I was able to really reflect on how I want to spend the next 20 or 30 years of my career. And I realized I just want to spend this time loving on nurses and physicians. We have such a wonderful healthcare system, but it's so very broken and complex. And our teams are burned out. They're tired. They're overwhelmed. They're so busy. They can barely keep their head above water. So I'm trying to join the chorus of what we call those healthcare rule breakers, as two of my colleagues like to call it, to just help love on them and help make it better for them.
You know, I love exactly what you said. You mentioned several things, right? You took some leaps of faith.
Mm-hmm.
You are now back home where you feel like you belong. But you
Mm-hmm.
started the story with mentorship, and I want to circle back to that.
Yeah.
How important is mentorship in the healthcare field or in any field? How important is mentorship? Because here it is, right? You're doctor now. You own your own company. But you just referenced that you had mentors and you're
Oh
going
yeah.
out to lunch with mentors. So
Yeah.
how important is that?
Oh, it's I make or break. It really is, especially in healthcare. I think the work we do is so very intense. It's literally life or death. It's unlike any other industry. And so having people around you who can guide you, give you honest but respectful feedback, I think is so important and powerful. And paying it forward, there are so many young new nurses out there who don't think that they qualify to be a mentor. But man, if you've got your RN license and you've made it through nursing school, you're ready to be a mentor to other nurses. So I think
Wow.
it's good to receive, but it's also equally important to pay it forward as a mentor.
So what are the benefits that you've seen as someone who's been mentored?
Yeah.
Did that kind of help shape your leadership perspective?
Absolutely. Yeah, it's good to go into it with a sense of humility. I've gotten great feedback about how I communicate, how I carry myself, how I maybe show in my nonverbals that I'm having a tough day or maybe not having the best week, and how I can adjust, be a better version of myself for my teams, which I think is so important, especially when you're a new leader. You're trying to learn all these technical skills, right? So we go to nursing school, we learn how to care for people, and then you get voluntold or kind of pushed a little bit to go into leadership. And most of us, we know nothing about budgets, finance, capital planning, contracts, legal, compliance. It's really complicated. And so having other leaders who are willing to step in and say, okay, take a deep breath. We're going to learn this one step at a time.
Yes.
Here's how it works. And I also think it's important to have people who can talk to you about the politics and the dynamics and the culture in the organization, because you can't just walk in and implement change in a place, right? You and I have lived that. You really need to
Yes.
understand who those people are, how open are they to innovation and change, and how you can adjust your approach and your style so that you can walk with them and not without them. It's important to bring them along.
You know, just dropping gems, Dr. Carter. You're dropping gems, and
Thanks.
one of the ones I love that you said is the workplace politics, because many of us don't know how to navigate the workplace politics.
Right.
I think we understand that leadership is a role, and we get there, and we don't like leadership because we don't know how to navigate the politics. So,
Sure.
how did you learn to navigate those politics? Right? You said you're associate chief nursing officer. You're at the top. You mentioned
Yeah.
800 some people. So
Yeah.
how do you navigate those politics if I'm new entering the leadership field?
Yeah. I think one, being honest and transparent and a little bit vulnerable. I think just admitting, like when I start in a new organization, I tell them up front the first 90 days, I'm a sponge. I'm not here to change anything unless it's critically emergent. I just need to soak in and learn from all of you how you like to do things. I need to see with my own eyes. And then
Yeah.
as any human does, I learn the hard way. I make mistakes. So a great
Yes.
example, unintentional, is I had brought a policy with me that related to the Code Blue team from a previous hospital
Yes.
that worked really well. I thought, oh, I'm so excited. Let me put this in place, you guys. It's going to save you a lot of time. Well, I bypassed basic change management principles, which is, awareness of the
Yeah.
change, desire to change. I just went right into, hey,
Yes.
let me help you fix this. And it did not go over very well. So thankfully
You,
I had a mentor that helped me reflect on that. What could we have done differently? And then I started again with a different angle and it went a whole lot smoother. So I think you go into it knowing that you're going to step on landmines. Just accept it. It's okay. Have grace for yourself. Take a breath and then try again and ask those people to help you understand those dynamics. People want to tell you there aren't politics, but by merit of there being human beings in a building together, there are always politics. You can't avoid it.
and I love your honesty, because nobody has brought this up, and this podcast is in 50 something episodes.
Yeah.
And you're talking about the workplace politics. And when I talk to people, I coach new leaders, I coach existing leaders. And one of the areas they struggle in is this workplace politics.
Yeah.
They don't know how to navigate it. And I think it depending on what role you in, you get stuck in this kind of sandwich where you're kind of the epitome of middle management, because you got to answer to the people under you, but you got to please those above you.
Yep.
And having said at the executive level, that doesn't change, because even as a chief administrative officer, I got to answer to the board.
Everybody has a boss. Everybody has a boss. Yep, that's right.
Everybody has a boss.
So
and I
true.
think people think when they get to those levels that they won't have a boss, but we all have somebody to answer to. So how do you strategize being able to answer to your boss? So
Yeah.
managing up, but then also managing down. What are some strategies you have to successfully do that? Because you are successful, as you stated, right? You started from the bottom and worked your way up. You didn't get there overnight. You
Right.
managed the people above you and under you to get to where you were.
Yeah, I think one of the biggest lessons I ever learned, and I wish I would have known this 20 years ago, was I spent a lot of time getting to know my leader. I watched them very carefully. Nurses were natural observers. That's part of our job. We're already trained to do that. And what I'm looking
Yes.
for are their strong emotions towards things or against things, and how they communicate, how they manage. And so I try to make sure that I'm learning that so I can adjust my style, not to the point of being untrue to who I am. But for example, if I've got a very intense, very, task oriented, very high energy leader, I'm going to communicate what I'm doing to them differently than someone who's very laid back, who's been doing it a long time and doesn't want to hear from me unless there's an emergency. It's on me to learn their style, and I adjust mine as their direct report to meet them halfway. And I have very honest conversations too, especially when I'm new. My intent is to be the best possible employee with you. Help me doing that by being upfront with me about your expectations. Not everybody tells you by default what their expectations are. They kind of just assume that you're going to figure it out. So I've often asked my new leaders to tell me what their expectations are of me, themselves, the team. And that's been really helpful too.
I love what you just called out, because a lot of people don't know how to communicate effectively.
Yeah.
And that what you just called out is a communication issue. If you
Yeah.
can effectively tell me what you're looking for from me, we're never going to be on the same page unless you can communicate effectively.
Right.
And it's nice that you've figured that out, right?
Right.
Having those brutal conversations with your leadership, I think, is important. Sometimes people are afraid to have those conversations because they're not sure how it's going to be received. But I think I'm similar to you. I am a direct, straight shooter. You always know where you stand, and I want to know that as well. Where do I stand? If I need to improve, let me know. You don't have to sugarcoat it for me, but that doesn't work for everyone, and I do recognize that. So for the people who are new into leadership, how do you what do you recommend for them to kind of start to form that relationship with their boss? You know, maybe they're a new nurse manager, right? Maybe they're a new director role. How can they work to form that relationship with their supervisor, their boss?
Yeah, I think the biggest challenge is finding time on their calendar so that you can have those one-to-ones. So I made the mistake as a new manager. I made the mistake of just assuming they're going to show up and talk to me when they need me, when in fact it was actually very helpful to that director who was kind enough to teach me that, hey, I want to meet with you as often as it's convenient for you or necessary, but I don't want to micromanage you either. So, send me some calendar invites. Let's block some time. And then I would share with them how I'd like to spend the time. I need to know from you what you need from me. And sometimes the response is, oh, well, you're doing great. And I'd say, I appreciate that. And I need more specifics. How can I communicate differently? This most recent situation with a physician colleague, did I handle that well in your eyes? So don't just take silence or assumption. I know they're super busy, but when you take the time to reach out to them as their employee, I think that sets you up for success. And when they're reflecting on how you're performing, I think that goes a very long way in how they appraise your performance because you've taken the time to ask those questions.
Now, I love the fact that you're addressing the communication. And you mentioned that if you would have known that 20 years ago, you'd be be different. So talk to me. You are coined as the chaos whisperer.
Yeah.
How did that come about, right? Did it come about, your years of wisdom and experience and, like you say, learning how to effectively communicate? Because I'm sure lack of communication leads to chaos.
Yeah.
So talk to me about that.
Sure. So I'm not the chaos whisperer. So what I realized is every nurse on the planet, by nature of what we do, is a chaos whisperer. Like you think about your very first clinical. You walk into a clinical setting and you're completely overwhelmed by the noise, the sounds, the smells, the, people at their absolute worst, having the worst day of their life. That's chaotic. And then you throw in the fear and that you're new. I mean, literally what we do from day one, from the beginning of our journey is we deal with chaos. And so I liked the idea of chaos whisperer because as I was sitting with a group of colleagues, we talked about how we can make healthcare better in the US. We came to the conclusion that this is what we all do full time. It doesn't matter if you're frontline, if you're leader, if you're in a skilled nursing facility or in a hospital, it's all the same. It's just pure chaos out there. And our job is to try to keep the humanity at the center of that. We need to be able to classify what's noise and what's truly critical for us to focus on. And every nurse has that skill set. So I put it on there because I thought it's a fun way to market and to advertise what we do as nurses. I go on podcasts that aren't necessarily healthcare focused. And so sometimes it's my responsibility to present the healthcare perspective on issues going on in the world. And so I like to bring that forward and help people understand what it is that nurses deal with every day and how amazing they are because they're able to handle all of that.
Some you just mentioned, right? And this is a leadership platform, but I also have a healthcare platform. But I think leaders walk into chaos every day.
Sure.
You walk into a new building, you can be an insurance agent or at a plant or something, right? You walk in and to your point, I think all that applies. Different smells, different people, different personalities.
Right. Oh, for sure.
Different personalities. So, as someone who has worked at that level, how have you navigated dealing with different personalities and people maybe not agreeing in the direction that you're taking things?
Yeah, I think of the best example I have. I'll tell you who taught me the most was someone who really did not like me at all from the get-go. And I appreciate her. We're actually very dear friends now. She sent me an email. She's a frontline clinician. I had sent an email to the staff in that department asking them to make a decision. I said, I'm not going to make the decision for you. You guys decide. It's your staffing. You tell me how to do this, but here are the options. Here's what we can work with. Here's what's on the table. Here's what we can't control. And her response was something along the lines of, you're asking us to commit suicide, but to pick the weapon. And I thought that was just so shocking. It was very clear to me that she felt very strongly about what I was asking them to do. So I invited her to come meet with me. I said, I can meet you on the unit, or you can come to my office, whatever you're most comfortable with, because I don't want you to be intimidated or feel like you're in the principal's office. So she sat down and met with me, and she had her arms crossed, her legs crossed, just very, very angry. And all I said was, I just want you to know that the impact of your words really broke my heart. It felt like you were disrespecting me, not as your leader or even a peer as a nurse, but as a human being. Was that your intention? And she just looked at me and went, I had no idea that it would affect you that way. And she started crying, which was not my intention. I didn't think that was going to happen at all. We ended up having this really interesting conversation where she said, I realize now that any leader that's come through here, I don't even see them as human. Like I just see a suit or a job title. I don't see a person. Wow. And I said, thank you for telling me that, because I didn't realize so it was this big light bulb moment of, a lot of times people don't like each other, or these different personalities have conflict because we've dehumanized who we are in the workplace. And one of the best strategies I've seen that's so simple, I mean, it'll make you laugh, is we would introduce ourselves at the beginning of meetings with one random fact about ourselves that was a fact that had nothing to do with the workplace. So I would introduce myself to the group and say, by the way, I'm the world's biggest Foo Fighters fan. Or, hey, by the way, I'm a bird nerd. Or, hey, I love the UT Longhorns. And then we would all do it as a group. Yeah. And what was interesting is the dynamics started changing. People would come up to me and talk to me about rock music or college football or birds or whatever, instead of only ever having workplace conversations. So I think I had tripped over that multiple times and struggled with those different personalities until I was able to humanize myself and my team. And then that seemed to really help a lot.
Dr. Carter, this has been an amazing conversation. We're going to get ready to go to commercial break. But when we come back, I usually do this at the end. When we come back after the commercial break, I'll ask you this, since you talked about kind of something funny, kind of breaks the ice. I'm going to ask you, you're at a table and you got 3 chairs. What 3 people would you bring to that table and why to talk about leadership? We're going to talk about it right after this commercial. Hey, did you hit that like button yet? That subscribe button yet? Well, if you didn't hit it, that's how I get views. I need the views. Sound Leadership with DJ invites you to like and subscribe to us on your favorite podcast platform. If you haven't, hit that bell, hit that subscribe button so you'll be notified of every single episode that we host here on Sound Leadership with DJ. Have you done it yet? All right, now back to this episode. All right, we are back. So let's talk about it. Who would you bring to that table and why?
Oh my gosh. So the first name that comes to mind is Brene Brown. And I know she creates strong feelings for a lot of people. I get it. It's not because she's a fellow Texas native, but her Dare to Lead book absolutely radically transformed the way I lead. I would love to just pick her brain and bring up specific situations. I'm sure she gets tagged all the time when she goes out to eat with her family. But I love her perspective on shame and empathy and how that influences her leadership approach. I think it's beautiful. I would love to have Dr. Jean Watson. Hopefully people know who she is. She's like the godmother of Caritas and the caring model of nursing. I think she's brought such a beautiful perspective to our sacred vocation. And I think we really need more of that in leadership and how we can infuse that in what we do. And then the third person I would bring is actually the author of a book I'm in the middle of reading. His name is Leidy Klotz, and the book is called Subtraction. And it's all about how we as humans are wired to add things to a process we want to change. When we see an issue, we add steps. We are not wired to remove them. And it's been so powerful in my work as I try to help leaders clear their calendars and streamline meetings. We are biologically wired to add instead of subtract. No wonder we're overwhelmed in healthcare. It's brilliant. So I would love to pick his brain and figure out how I could infuse that in the work that I do.
I love the three people that you're bringing to your table, and I love the reason that you're bringing them to your table. And it's very reflective of who you are as have started your own business to teach people how to clear their schedule and clear their calendars, as you just mentioned. So talk to me about what that means to clear your calendar. Because when I hear you say that, I'm looking at my calendar right now. And I'm like,
probably looks like Tetris from heck. Yeah, I bet.
What do you mean? I can't. That's not how this works.
Right.
So talk to us about that. What does that mean?
Yeah. So what I have found in my working in different hospitals, there is one factor that seems to be the same no matter where I've gone. And it's that the calendars, especially for middle management, become completely overwhelmed. And the reason is, especially for nurse leaders, they are just like a nurse on an inpatient unit. They are like the flight controller, controlling all of the other disciplines, all of the other departments. We're the one trying to triage literally everything going on because nursing touches everything. What often happens is those other leaders, those other departments, and all those projects, when they send you a calendar invite, they don't see what's on your calendar. All they see is their work, which is important. And so they'll send you invites. The default is 1 hour, and we're going to do this every single week. We don't really pause and say, okay, does it need to be every week? Does it need to be an hour? Hey, we don't negotiate either because we're afraid to hurt feelings, or again, back to those politics. Like if you were to send me an invite, DJ, it'd be hard for me as a new leader to say, is it really critical that I personally attend? Or are you just sending this to me as informational so I know that you're having this meeting? Like, we just need to talk about it. And so what ends up happening is these calendars become, I've literally seen an executive's calendar from 6 a.m. to 10 p.m. be triple or quadruple booked every hour. Now, she's not going to all those meetings because she can't clone herself. So it's rendering her ineffective. She's frustrated. Her team thinks she's not showing up to these meetings because she doesn't care. And it creates this vicious cycle of negativity. Why don't we just pause and ask ourselves, okay, as a team, let's come together. Let's look at these calendars and let's take off things that don't meet the criteria of mission critical. Maybe we'll add them back on in a month or two. I'm not saying they're gone forever, but just asking a few basic triage questions has radically transformed people's calendars, and they can almost start crying because now there's actual free time on their calendar to go out and round, to engage with their teams, to round on those patients, do all of those things that we want to be able to do, that we know are best practice, but we've just never been given permission or the time to do it. We just need to change that culture.
Is that something that you came up with when you became a business owner, or is that a practice before becoming a business owner?
I started it when I took over the ACNO role after we got through I think it was the third or fourth wave of the pandemic, because at that time it was every single day was just emergency management, right? And what's funny about the pandemic, did you notice that all of our meetings got canceled, right? So we could all sit in those emergency management meetings. What happened? Did anybody suffer because we took those meetings off? Nope. In fact, we had more time to focus on what we needed to do. The pandemic taught us a lot about how slow we are to innovate in healthcare, but we sure made it happen when we needed to.
I took over an organization, and I remember one thing about Demetrius is he's honest. Don't ask me if you don't want the honest truth.
Okay.
They say, how are we doing? I said, well, y'all have a lot of meetings. I don't see a lot of things getting done. This isn't boardroom. I don't see a lot of things getting done. We have a lot of meetings about the problem, and that's really what shifted my field into healthcare, into leadership, is because what I found is I would be in the meeting talking about change and making some questionable cuts, but we're eating food that's catered in. Right. So we got to go on this leadership retreat, but we're gonna not buy that bladder scanner. But you got to be at this leadership retreat. Oh my gosh,
so true.
So true. I wanted to be the vessel that changes. So the reason why I got my MBA and I obtained my MSc is because when I got to the table, you can no longer just say anything. You can no longer say it's not in the budget. Let's pull down. Let's look at the financial statements. Yeah. What are our KPIs, and have we ever hit those, or are those goals that we have not hit? And that's a goal, but it's not based in reality. We can always say we want to lower this or we want to increase this, but what have we done to do that? And I think that's what's always interesting from a leadership perspective is sometimes goals are set, but they're just that. They're just a goal. Right. I think we have to get back to really having meetings that are meaningful and emailing what can be emailed. Correct.
And so that's exactly one of the offerings that I do right now. So I just had this webinar, and so it's little tips and tricks that I've learned throughout the years that I've just put together in this little framework. And it's things like, your meetings should have ground rules. Your meetings should have roles like a process checker, a timekeeper, a scribe. Your minutes should only consist of deliverables, who owns the deliverable, when it's due, and the who, what, when, right? So my meeting minutes went from being 20 pages that nobody's going to read, let's be honest, to one page with just 3 columns of deliverables. And here's what's great is you can send it out as soon as the meeting's over. Everybody knows their marching orders.
Yes.
And I send it out one more time before the next meeting so that we all know exactly what we're going to talk about. We were able to make change happen infinitely faster than we had before. So it's just little things like that that make a huge difference. If we're going to have this meeting, let's make it meaningful and drive action. And by the way, we're going to start on time and end on time because everybody in here is busy and I respect everybody's time.
Listen, I applaud what you're doing. I love what you're doing. We're going to get to talking some more about your business coming up, but I will be remiss. I called it out, and I want you to get your flowers while you can. Nurse scientist as a published author. So talk to us about what you've done as a nurse scientist and the research you've conducted and the articles you have published.
Sure. Well, I appreciate you asking. I've got 2 publications that I can call mine and then some poster presentations. Thank you. But going back for that DNP, that's part of your work is you spend 2 years building this beautiful baby project that's like having a kid and you can finally publish it. So what I was able to publish, the ironic title of my work was Nurse Manager Resilience. But as I said, I went through the pandemic while I was doing this. So I added the words Nurse Manager Resilience in a pandemic. Didn't know I was going to need to do that. So we did that. We used actually a tool from Duke University, which is where I actually got my degree. They have an entire center dedicated to healthcare worker well-being and resilience. And so we used a tool called Three Good Things, and it sent out these automated texts, and it ended up being really valuable in the midst of the pandemic to our nurse managers because a lot of us lost sight of what's going well because we're completely focused on what's broken and trying to keep people alive. And of course, you do the pre and post, we rate them on a validated scale, and we actually saw a pretty statistically significant improvement, even though we were in the worst time in history in healthcare. So I'm very proud of that work because I felt like it made a difference for the people who are doing the hardest job in a hospital, which are those nurse managers.
I love it. And, to call you a nurse scientist is amazing because I don't think a lot of people know that DNPs are considered nurse scientists as well. So I just wanted to call that out.
Well, thank you.
Now, let's segue into your business. What made you start a business as a leader? You were at the epitome. You were a chief nursing officer. That's what you wanted. Now you're a business owner. So why the shift?
Yeah.
And tell us about the business.
Yeah. So I'll be vulnerable for a second. I recognize that by pushing for that traditional executive track, I think what I was chasing was ego. I was a high performer, an intense, career person, just like a lot of nurses and physicians are. So in my mind, being a leader was always a calling of mine. And so I thought, the higher I go, the more impact I can have on these precious teams. But at the same time, I also found that it is even more challenging than people think. There are so many students that I'll meet with in groups and I'll tell them, you need to tell your CNO, your ACNO, and your director and your managers, thank you. Because what they do is silent work. You don't see the battles that they're fighting behind closed doors. They are advocating all day long for you, and they don't get to win every battle, but they have to leave that boardroom in lockstep with their peers on the exec team and tell you, what's happening, even if it's news that they don't personally agree with. They don't have the luxury of telling you that they don't agree with it. And it's really hard. That moral distress is really difficult for these leaders, and that continues today. So I realized that, okay, if my calling is truly to help people, to help nurses and physicians and these hospital workers, I don't know that the CNO or the system chief nurse exec track is necessarily going to be the most fulfilling or the impactful for me personally. I know so many CNOs and CNEs who do this really, really well. And I think they are made for that. I think I recognized I had to let go of my ego and my pride. And instead of chasing ego, I needed to chase my purpose. And so creating this business was born out of that desire to really just serve others in that capacity.
So tell us what exactly you do and how you serve others and how you correct their operational and clinical problems.
Yeah, so it's consulting, which I know we are up to our ears in consultants in every industry. So I know that's a little tricky. So what the heck do you consult on? I'm challenged to narrow down what my focus is because I can't just come out the gate with 20 different things. I mean, I really am trying to make sure that I am out there marketing myself, who I am as a person, building trust with people and establishing rapport. So that's really what I've spent the first year doing. And I have 3 specific services that I'm starting with, which is that minimizing the interruptions for the nurses through that clinician refocus framework. Time motion observations. We document how nurses are spending their time, how chaotic their work environment is, and their work environment is in a data-driven way. And what's really cool about it, and I've been doing this for 10 years, is you show that data to the exec team who's not clinical, except for maybe 1 or 2 people, and they're completely shocked. Nurses maybe get 14 to 20% of their shift in actual patient care. The other 80% is interruptions, running back and forth for medication supplies that they don't have on hand, being interrupted, in person, by phone, by pager, by call light. I mean, it's truly chaotic. So what I love about that framework is I can actually quantify it. And then I use that to give it to the nurses and say, what would you like to do about this? And I'm telling you, they know exactly what they need. They already have the answers. And every single intervention we've come up with to date has cost the organization $0. All we're doing is just changing how they manage the chaos. And then we'll repeat those observations and we'll say, okay, let's see if we helped. The first group I did this with, we gave them 2 full hours back into their shift and they focused back on their patients. And guess what happened to their metrics? Every single metric improved: falls, HAIs, patient experience, all of it. It was such an improvement that actually the NDNQI representative called me in my office and said, is it possible you're fudging your own data? I was like, what do you mean, fudging my own data? She's like, how did y'all go from 10th percentile to 90th percentile in such a short time? And I'm like, I gave nurses time back with their patients. So that's one framework that I do. And I do a similar approach with leaders, except theirs is focused on the calendars and the meetings. And then the third thing I do is called Sacred Vocation. It's 5 courses or 5 sessions. This program was created by UT Health, the McGovern Center for Ethics, many years ago. I went through it as a nurse manager twice because I loved it so much. And I've brought it to 2 health systems. And what we do is we reconnect healthcare workers with their sense of meaning. And we do that by helping them redefine what healing behaviors are and what harming behaviors are. And that you have a choice in every interaction to be a healer or a harmer. And if you can manage to choose to be a healer more than a harmer, you're going to get meaning back in your work. And we do this with everyone. It's not just nursing. We'll work with EVS, respiratory physicians, everybody. Wow. And the leaders really like it for the leadership team too.
Dr. Carter, you have brought a breath of fresh air to this podcast.
Oh, thank you.
Just what you spilled over to the listeners and the people watching this have been amazing. How can they reach you?
Oh, thank you. Yeah, I'm on LinkedIn. So that's the only social media platform. I'm not cool on Instagram or TikTok like everybody else, but I'm on LinkedIn. You can find me, Dr. Megan Carter. And then I have my website link we can include in this episode, and you guys can email me anytime as well.
But what is that website? How do they find you?
Yep. So it's MC Healthcare Consulting LLC.com.
Hey, I love it. Dr. Carter, a fabulous interview. Appreciate you taking time out of your day. As we draw this to a close, I want you to look right into that camera and speak to the young you. What would you say to the young you that you wish you've known?
Oh, gosh. That's such a great question, DJ, man. I would say you're going to be okay. Every mistake, every struggle is for a reason, and you're going to use that to help others in the future.
Powerful. You've heard it here from Dr. Carter. Thank you so much for taking time out of your day to speak with me. I know it's an afternoon for you, early morning for me here in Hawaii, but I thank you. And this is what Sound Leadership is about. It's about speaking with inspiring leaders like yourself. So thank you so much. I really appreciate it.
Thank you, DJ, for the time. I really appreciate it.
And, I'd like to thank the viewers and the listeners for embarking on this journey with us. Here at Sound Leadership with DJ, we really appreciate you for liking and subscribing. If today's conversation sparked a new ideal, inspired you to take action, or simply left you wanting more, we invite you to connect with us. Explore more of our world by following us on YouTube and LinkedIn at Sound Leadership with DJ, where the conversation continues to thrive. Don't let the journey stop there. Subscribe to Sound Leadership with DJ on your favorite platform. That includes Apple Music, Alexa, iHeart, and so much more. Simply search Sound Leadership with DJ and hit that subscribe button. Hey, as we part ways today, remember, leadership is a journey, not a destination. Keep striving to learn and grow and never give up on your goals. We're honored to be a part of your leadership journey and anticipate welcoming you here back on Sound Leadership with DJ. Until next time, keep leading, keep growing, and remember, within the Sound Leadership with DJ community, you're always in good company.
Thanks for tuning into Sound Leadership with DJ. If you like this episode, be sure to subscribe to the show on your favorite podcast platform. Share your favorite takeaways with a friend or colleague. Leave a review and let us know what you think. And remember, leadership is not just a title, it's a choice. Choose to lead with purpose, passion, and impact. See you